all of you. Fine. Uh, Let me introduce me to you all. Some of you have already attended my classes in the ahead, and some of you are still going to attend my class in the near future in the ahead. Due to coronavirus situation worldwide, we are not able to start the classes for the new students, but soon we'll be going to start. Fine. Myself to you all. My name is Dr. Nitin Singh. I am an endodontist and operative dentist. I'm teaching in Ahead Academy 7 years. Fine. So I'll be discussing two very important topics from the endodontics. One is canal and the other one is irrigation in endodontics. Fine. And these two topics I'll be discussing separately. First, I'll be talking about canal negotiation, and after the canal negotiation, I'll be talking about irrigation in endodontics. Today, my class will be very much practical. I'm not going to go into very much theoretical part, as all of you are basically going to perform on the patient. So I'll be talking very much clinically. Fine. So let's start with our today's discussion. And the first topic is canal negotiation. Now, to understand canal negotiation, I have drawn a simple photograph for you, which you have already seen. Now, just see carefully. Uh, I hope all of you can see this clearly. I hope so. Yeah. Now, what you can see, this is what the whole of your molar, right? Uh, the crown portion of the tooth, and these are two roots, mesial root and the distal root. Right now, the photograph is after you have performed your X. Basically, in the access opening, what we do, we just remove the root, the pulp chamber. Fine. So after removing the roof, what you can see inside, these are the canals. Fine. These are your canals. As you can see, the canal is quite broader on the upper aspect. As you keep on moving apically, 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 further apically, you can see the canal is a bit constricted. It is getting a bit narrow. And what you can see, it is getting narrow at point. It is becoming very narrow, which is what known as apical constriction. And then again the canal a bit flares up and exiting at the tip of the root, which you call it as apical foramen. Fine. So this is the point of your apical constriction, and this is the point of your apical foramen. Other than this, what you can see right now in the chamber a very big calcified mass. This mass is what known as pulp stone. I repeat, this calcified mass is what known as pulp stone. This pulp stone uh, you may find in some of the teeth, especially when the teeth are a bit aging, like in the elderly population nearly at the age of 40, 50, or even 60s, 70s also. However, the important thing about this, it is not found in all the teeth. It may be found in the healthy as well as in the carious teeth, which requires filling, or it may require your endodontic treatment. Whereas when the tooth will be going to go for the endodontic treatment, that is root canal treatment, in that situation, if you encounter this pulp stone, you will be able to see in your radiograph as this is a calcified mass. So what you will be able to see in the radiograph, and while performing your endodontic treatment in these kinds of teeth, you need to remove this stone. Fine. Now in the canal, what you can see at this point, I'll be very, I'm putting this paper close to the screen as you will able to appreciate. You can see small something. These are what small calcified mass in, and these are known as diffuse denticles. This is what known as diffuse denticles, which you can see inside the canal. This is what after excess opening you can see. However, finding these diffuse denticles and pulp stone is not mandatory. In some of the cases, you may find these calcified mass, and in some of the cases, it need not be कि वो present होंगे ही होंगे. Fine. Now, the first step in endodontic treatment, you are going to do what? De-roofing. After giving the local anesthesia, you have just done the de-roofing. Now, after de-roofing, you have done your de-roofing. Now, after de-roofing, what you are going to do? Now, what we are after doing the excess opening, we just take K file. We just take what? A K file and put it inside the canal. Now the question arises: which file you are going to? It should be made up of stainless steel, nickel titanium, or we should put femurs, or we should put H files. And in what motion should we put it inside the canal, and till what point we will be going to put it? Till the middle third, apical third, minor apical diameter, major apical diameter, at what point? And if the file is not going further, which many of the operators says the canal is calcified, we tell to the patient, जी आपकी फाइल आगे नहीं जा रही है because आपका canal में पत्थर जमा है, your canal is calcified. Is it true or is it wrong? We need to understand. Fine. And when we are putting the file inside the canal, what should be there in the canal? This is again a very important thing. So this is what canal negotiation is. In the canal negotiation, what we do after excess opening, we take a K file. We take